Hello, everybody. Thank you for coming tonight. Tonight, I'm going to be talking about the rise of Chinese medicine therapies for autism and ADHD. Rise, I don't mean to say that these therapies are new, although some are now being developed, but there is a lot of application of these therapies in a lot of settings now, and a lot of diagnosis and a lot of concern around autism and ADHD now. I'm going to be talking primarily about mainland China, also some about Hong Kong. My name is Amir Hampel, or Ameng. I am an anthropologist. I'm a professor in the Global China Studies Department at New York University, Shanghai. And I want to, before I begin, thank the Nexus Asia initiative here at the University of Chicago Campus in Hong Kong for funding my research on this topic. And also to my thanks to the NYU Shanghai Center for Global Health Equity that also helped to pay for the research. So my talk also begins with a story about financing and about this company, specifically Regencell, which was recently in the headlines in June. It's a Hong Kong company that is listed on NASDAQ in New York. And this is a company making Chinese herbal medicines, patent medicines, zhongcheng yao, for autism and ADHD. And the stocks had a really intense rally, and the company briefly topped Lululemon in value. The owner and founder of the company was about the 40th richest person in the world at that moment. The stock collapsed afterwards, it's not entirely clear why the stock had this rally. There are talks about some manipulation, speculation, but it does show that there is interest and excitement around this idea that there could be resources within the Chinese medical tradition for treating these conditions, including herbal medicine, acupuncture. And you might be very likely thinking, but does this work? Can acupuncture treat, for example, autism? Well, there's a lot of interest in this in scientific circles. A lot of people are asking this question. A couple of years ago, this review of the evidence, research evidence of acupuncture for autism was published in Frontiers in Psychiatry, and then had to be retracted and republished because of the controversy around what was perceived as a leading journal promoting pseudoscience. And the editor of the journal had to post a reply, and later on, the article had to be resubmitted with a lot more caveats about the evidence available. So if you are coming here tonight to learn about what about my nephew or my niece or whoever, I'm not a clinician. There are people in this room who you would be much better off talking to. I'm a medical anthropologist. I'm interested in these therapies. Of course, I also want to know how they work and for whom. I'm, of course, interested. But what I'm trained to study is how people see the world, what they think, what's going on in their minds. And that's also a medical question. Because if people believe a therapy is legitimate and useful, then they will go and try to use that therapy if they have a need. Beliefs drive health-seeking behavior. So my research lately has revolved around two questions in mainland China about how parents are interpreting children's behaviors, especially through these lenses of ADHD and autism, and also about how patients, doctors, behavioral therapists, different people who are intervening to try to treat children or seeking help for their own children, how do they understand scientific research on Chinese medicine? So this work comes out of my previous research on the development of psychology in China over the past 20 years, and also on social skills training programs for young professionals. There's a lot of attention to social skills now, not only children's social skills, but also adults trying to learn how to be confident, extroverted, this kind of thing. So while I was doing research on these topics, I came across also similar things focused on children. So as an anthropologist, I like to go talk to people, do what they're doing. This is a group a psychological personal growth group in Shenzhen that I attended. There I am. To really understand what people are thinking, you have to talk to them, participate as much as you can in what they are doing. This is the premise of ethnography and anthropology. And while I was living in Shenzhen, I noticed that all around my neighborhood, people were opening these clinics for pediatric massage therapy, 推拿. And moreover, they were advertising treatments for things that I found quite surprising: ADHD, tic disorders, autism, and obsessive behaviors. Problems that many of us probably think are more in the realm of psychiatry or psychotherapy than massage or Chinese medicine. So I started to ask, how and why are Chinese medicine therapies for ASD, that's autism spectrum disorder, and ADHD, why are these being developed and used? So today my talk focuses on these two issues. I'm going to give just a big background of some of what I've been looking at, thinking about, and we can get more into details in the Q&A. I'll talk about the social and cultural contexts of Chinese medicine and of ADHD and ASD, and the role of scientific evidence in legitimizing Chinese medicine. And one kind of question in the background that is motivating my research is a concern shared by a lot of people in the Chinese medicine world about how this tradition is changing as it is being integrated into biomedical care. Biomedicine is the scholarly term we often use for what many of us probably just call medicine or Western medicine, based in biological understandings of the body, anatomy, biochemistry, things like that. So I have done some research looking at clinical research, also kind of humanistic studies of Chinese medicine. I've been looking at online forums for parents of children diagnosed with ADHD and autism. And I have been conducting interviews with Chinese medicine clinicians, behavioral therapists working with diagnosed children, with parents, and with people who are doing clinical studies to try to place Chinese medicine on an empirical footing that could legitimate it more broadly. So my talk will be split into these three topics, but before I get into discussing these cultural and social issues, I want to clarify a couple of things about how I view ASD and ADHD. These are not discrete diseases. It doesn't mean that they're not problems, sometimes very severe problems. It means that they are syndromes. They are groups of symptoms that often occur together, but they are therefore very broad. I mean, if I tell you that I have a sore throat and a cough, which I do, what disease do I have? It could be many different things, right? The underlying pathologies are not well understood and are likely multiple. This is not one thing. I mean, even ASD, spectrum is in the name, right? Moreover, there's a lot of comorbidity with these conditions. That means that you don't just get one thing. If you're diagnosed with ASD, it's very likely you also have digestive problems, emotional issues. In fact, ADHD and ASD are often diagnosed together. So right from the beginning, I want to challenge this idea that we're talking about two distinct things that either these therapies are good for or not, because actually this is a very complicated, sometimes blurry range of ever-shifting symptoms that occur in children as they are themselves developing and growing. So it's very difficult to produce universal scientific knowledge about treatments. And this is one reason why I think treatments for these conditions are a really interesting place to look at acceptance socially for diverse therapies, including holistic ones, like those offered by Chinese medicine practitioners. So rates of diagnosis and treatment are rising rapidly worldwide, and that is another reason to pay attention to these therapies. So in China in particular, as far as I can gather from the studies I found, prescriptions of ADHD medications are going up rapidly in this decade. This is a study of prescriptions offered by several hospitals, which went up 5 times, fivefold in this 10-year period. In Hong Kong, it's even more. 36-fold increase in ADHD medication prescriptions in a 15-year period. And so the question that people ask, a very important one, is there more pathology? Are young adults or are children having more problems? Or is it just that there's better awareness, more screening for these conditions, so people are more likely to catch them? Definitely there is more awareness thanks to many NGOs, thanks to broader availability of services. This is the number of organizations in mainland China offering treatments for autism over this period. And you can see how in a 15-year period, really there's just so much more available, so many more treatments. There's also a lot of official attention to early childhood health. This is the Healthy China 2030 initiative, part of which involves screening children for early childhood developmental issues. And that is being reinforced and rolled out in hospitals, clinics, everywhere, as part of making a healthy population. Children are the future, right? So have a healthy population. You want to invest in child health. And at this clinic, which I went to, if you would go there as a parent, you would also encounter things that might lead you to start thinking about potential diagnoses for your children's problems, like this sign talking about speech developmental delays, indicating that this could be the sign of a serious issue. So definitely awareness is part of the story of what's happening. And there's so much content online. This is on Red, Xiaohongshu. If you start typing study problems for my kid, you're very likely to be directed to content about ADHD, for example. These are graphs of social media and media engagement with the topics at the top, ADHD, at the bottom, ASD. And we can really see around 2022, 2023, a big spike in interest and engagement in these topics in online forums in mainland China. So this is one part of the background. Another thing that is very relevant to why these conditions are receiving attention are some of the unique conditions of being a child in China. People talk a lot about the huge academic pressures, also about a generation of single children, often being raised by grandparents or in boarding schools. There are tens of millions of children not being raised by their parents primarily, and rapid changes in parenting, such as younger parents wanting to hear what experts are saying is the right way to deal with behavioral problems, for example. So academic pressures can drive medical interventions, like this tonic that is advertised from the early 20th century as helping children to study. And it's not, I think, too much of a stretch to see a line from that to contemporary products like this Chinese herbal patent formula that you can get at any pharmacy that advertises among its uses that it can be used for ADHD. And you see the children, one is holding a book, the other a pencil. The implications are pretty clear. Another thing that is relevant that is maybe less on people's radar is there's a lot of concern around social skills. A lot of people feel lonely, isolated, and might be worried that their children are not being social enough. At the same time, being extroverted is very valued and rewarded. You need to give talks, you need to pitch your ideas to your investors, granting agencies, whatever it is. If you go on Red, you'll see advice for how to make your child hypersocial, how to make them a 社牛, like a hypersocial kid, and parents are sharing tips about this. They might be looking to American ideas about how to do this, like positive encouragement education in America. I can do anything I set my mind to. People are looking to these models for ways to make children confident, extroverted. And at the same time, they are doubting their own parenting, and especially the ideas that they see in older generations. This can have a direct influence, I think, on who is presenting at clinics. So one thing that has come up in my research interviews is parents complaining that, well, grandparents, they don't see the signs of a developmental disorder in time. They just think the kid is a troublemaker. Or even might think that a child who is not speaking might just be very intelligent. And there's the saying, don't know, 贵人语迟. So we have this kind of idea that younger parents would be more versed in scientific ideas about parenting, would have better ideas about what to do. And where are these ideas coming from? A lot are coming from their readings of psychology. In the past 20 years, psychological literature, information, services have proliferated in China. Scholars talk about this as a psycho boom because it has really been such a giant cultural phenomena. Now, this also is relevant to parenting and to ideas about correct behavior of children. So if you go to any children's bookstore in China, to the children's section, you will see a lot of mostly translated books about emotions, behavior, like this one about My Little Emotional Monster. Some of this sounds very liberal, like teaching children to express their emotions, but some of it is not very liberal at all. It's about controlling emotions like anger that are unwanted, or even using all kinds of psychological tricks, play to increase attention. So children are subjected to intense scrutiny. Many children, not everyone. Scholars have called this intensive parenting. As part of this, if you only have one child, now maybe two, you'll be investing a lot and giving a lot of attention to that child, very likely. You might be tempted to take them, if they're having trouble in school, to something like this, a training program offered by a major psychiatric hospital that promises, through consultations with psychiatrists and psychologists, to help your child become a better student and better at socializing. And you can see how these are concerns that resonate with, respectively, ADHD and ASD. So again, these are very broad categories. It's just more likely that people might start to think about these diagnoses. Another big issue that has come up in my work is something that is an issue globally, concerns about technology, about how that is affecting children's attention and also their social skills. So we have a lot of cultural resonance around these ideas about academics, social skills that must be affecting help seeking and diagnosis. And I want to say at this point, I don't think there is a correct rate of diagnosis. Treatment choices are complex and individual depending on family situations, individual children. They are as much philosophical questions as they are medical about what's right for each child. I don't want to tell people, I don't want to suggest, oh, this is a story of overexpansion of diagnosis. But just to point out that there is a lot of attention to these issues now. There are a lot of unresolved questions. As I mentioned, these might not even be discrete conditions. If they are, there's a lot of debate about whether or not they should be treated as diseases. There's a lot of talk of neurodiversity. And there are questions about what therapies actually do, mainstream therapies. Like, for example, amphetamines used for ADHD. Are they treating a disease called ADHD? Treating it biochemically, something like that? Probably not. They are changing children's behavior in a way that is seen as desirable, but they are not treating an underlying disease mechanism. It's not like taking an antibiotic that kills a specific pathogen, right? And there are concerns about the therapies as well. There is some dissatisfaction with mainstream treatments. Many parents do not want to give pharmaceuticals to children, especially this is an issue in ADHD treatment. They do have side effects. In terms of ASD, behavioral therapy can be a very big investment of time and money and doesn't always show results. For some people, there are great results, not for everybody. So these are some of the concerns. At the same time, parents often feel huge pressure to intervene early and in any way that they can, especially for ASD. There's an idea that there's a golden period, and if you miss that, anything you do will be less effective. So I think that that also drives parents, caregivers, to try as many therapies as they can. And that brings us to Chinese medicine. So I'm using the term Chinese medicine. You might be familiar with it as TCM, traditional Chinese medicine. So from an academic perspective, actually, CM is much older than TCM. TCM refers to the Chinese medicine system that has been standardized in China, put into hospitals, teaching, taught in universities of medical colleges. That's TCM. CM is something broader. It refers to a whole system of thought about health and disease, like, okay, it's summertime now, what should I be eating? What kind of, liang cha should I be drinking? These kind of issues. In practice, Chinese medicine, or TCM, is very much integrated with Western medicine in practice. Chinese medicine, as I mentioned, some people might not think of it in relation to issues that we might consider as psychiatric, but in fact, there is a very long history and a lot of theory in Chinese medicine about managing emotions, using, for example, the 5 elements. Each one is connected with an organ and also with emotions, which leads to a whole set of therapeutic logics about how to intervene in psychological issues. Also, just very commonly, this was on a flight I took to Hong Kong last year or earlier this year. There's a kind of cultural sense that some of these herbal formulas might help with cognitive function. There's a long history of pediatrics in Chinese medicine, and some people find evidence in older texts about treatments for what today would be called autism in particular, like the idea of yuchi, slow development of speech, was described already, I believe, in the Song Dynasty, if not before. These are not one-to-one correspondences with autism, but people look to this for legitimation of therapies used today. What I found in my research is that, in fact, in practice in mainland China, TCM is widely used for these conditions. For ADHD, which is the attentional problems are the top presenting issue in psychiatric wards for children, if you are being given pharmaceutical treatments, you are very, very likely to also be given Chinese medicine formulas, often to help with side effects like appetite, insomnia, restlessness that might be caused by the drugs, also sometimes to help with the effectiveness of the drugs as well. This is ubiquitous. And my research also suggests that home use is very, very common as well. And Chinese medicine here is referring to a very wide range of treatments, everything from herbal medicines prescribed by a doctor, individualized formulas, patent medicines, medicinal patches that you can put on acupoints, medicinal foods, acupressure, acupuncture, massage, exercises, a whole range of things that fall under this umbrella. They're unified by the kind of philosophical approach and logic of Chinese medicine. Here's one thing that, that is commonly used for behavioral problems in children, pediatric intelligence syrup, which is indicated here for ADHD. And in fact, this hospital website promotes its use for autism as well. You see medical experts like Chinese medical doctors with, this person has 120,000 engagements with her content, which is all about Chinese medicine for these conditions. And she's explaining some ideas like about the balance of yin and yang and how they might be applied to thinking about these conditions. There are all kinds of remedies offered, like this one I found. It looked like, I don't know, maybe my daughter would enjoy it. Rub some ginger on your back to help with attention. This content also and Chinese medical logics also push against these diagnoses in some ways. So you hear for ADHD, you have 4 different ideas about the foods that a child should be eating, but they have different functions in Chinese medical theory. For example, to strengthen the spleen and calm the spirit, or to get rid of heat and melt the phlegm. These kind of indications, which don't make sense from a biomedical perspective, because they are from Chinese medical theory. They are referring to diagnostic patterns. So somebody might present as ADHD or be diagnosed as such, but clinically, a Chinese medicine doctor could diagnose them with any of these conditions or more. Any of these patterns of disorder. This is research that's very highly cited from a few years ago about what kind of conditions were actually, what kind of syndromes in Chinese medical theory were diagnosed at a clinic in a Chinese hospital for children who came in with ADHD. So just very briefly to indicate one kind of logic that might be used is to open the heart orifice. So the heart orifice is, the heart is supposed to govern things like speech. It's connected to the tongue, social communication, proper attention in social situations, the 心神. But this can be disturbed by blood stasis or phlegm. If that's the case, you might want to take soup to wash the heart. This kind of idea about treatment logics is used to promote. These are stickers that can go on children's acupressure points. And this is saying that their academics, now their orifice will be open for the academics. This can found whole treatment approaches, schools of therapy, like Kaiqiao, orifice opening acupuncture for autism from a few years ago. Similar therapies are also being used in the US. There is a group in Portland, Oregon, that is using Kaiqiao Tuina medical massage to try to treat autism. And in fact, have trained therapists working around the US and North America. There is international interest in these therapies. In the past few years, especially, there's something like a 3- or 4-fold increase on Google searches for ADHD plus Chinese medicine, as an example, with a lot of interest from Northern Europe, North America, Australia. I've gone on Amazon to see what herbal supplements people are using for these conditions. And there are many, some of which aren't even marketed as Chinese medicine. They're just called herbal formulas. But if you know a bit about Chinese medicine and look at the formula, you can see, they're trying to reduce the yang, qi, or they're trying to adjust the balance of certain things. And the materials are all Chinese medicine, materia medica. You might not even know you're using Chinese medicine. You see, this is Regencell Bioscience, which we started the talk with. In their advertisement on Times Square, you don't even see a reference to Chinese medicine. It's all natural herbs. Maybe it's seen as bad marketing right now in the US. But in China, definitely, it's often seen as good these days to be affiliated with Chinese medicine. Chinese people should have confidence in Chinese medicine. And in general, in recent years, there's a lot of talk in mainland China about cultural confidence, the idea that Chinese people should reconnect with traditions and be proud of them, and Chinese medicine is a big part of that. People are practicing, young people, 八段锦, a kind of qigong exercise has become very, very popular, I would say, in the past 2-3 years, post-COVID. If you search on the search engine Baidu for Chinese medicine, health maintenance, 养生, also just the past few years have seen a huge rise in interest in this. The Chinese government is funding and working with the WHO to promote traditional medicines. This is a signing ceremony last year. There's a lot of investment in research in Chinese medicine. There's also a huge pressure to publish research in any field, and that applies as well to Chinese medicine. China is trying to become a research powerhouse. And so people at every level are pressured to publish. And in fact, there is a big rise in publications on ADHD, autism, and Chinese medicine for these conditions. Mental health is another big focus for developing therapies. There's a lot of interest in indigenous psychotherapies, including research on Chinese medicine for mind-body issues. And this big conference last year in Hangzhou that attracted over 200 people to talk about what Chinese culture can offer to mind-body medicine. Often ideas from Chinese medicine are being integrated with psychotherapy. For example, this is an advertisement for an intervention that is using both the logic of opening the heart orifice and also doing behavioral therapy at once. There's also a lot of money to be made by offering these programs. Chinese medicine is being marketed now to young people in very savvy ways. This was at a mall near me. They had a huge Chinese medicine kind of experience center where you could try moxibustion or massage for free. So there's a lot of promotion and a lot of support for Chinese medicine at an official level, but also there is some controversy, especially around pediatrics. So when I talk to people in the autism community and early childhood development psychiatry, some of them really dislike Chinese medicine. They say, how can they be sticking needles in children? I've seen videos of them screaming. It's quite awful. They have to be held down. My sense is that's not typical from talking to clinicians, but this is a perception. Also, this is the probably most important WeChat public account for parents of children diagnosed with autism. Any content about Chinese medicine there is negative. They're saying, oh, those people who can cure autism with their magical treatments are all scammers. This person just sticks a few needles in the kid and takes 7,000 renminbi. What a scam. This is an account by a popular pediatrician. These days, if you don't know, these are the Sanfu Tian. If you need to get the cold damp out of your body, you should go and expose your back to the sun these days, get a lot of sun to expel the last of the cold before we shift into the fall. So some people are trying to do this for their kids, apparently. And this pediatrician is warning that you could injure your child by using a heating patch. The biggest controversy is around, of course, whether or not these therapies work. And if they do work, is it just placebo? So of course, the placebo effect is very powerful. And yet, if people are talking about manipulations through massage or acupuncture of something called qi in the body, for example, it's easy to think about things that seem a bit superstitious and ridiculous, like this qi master who can knock down this big row of people. Qi has been taken very seriously as an object of scientific study. The most controversial part is what's called Wai Qi, or external qi. And it has been studied as applied to surgeries, for example. Can somebody project qi to improve surgery outcomes? Acupuncture for anesthesia was used. Research about this was published in this journal since the 1990s. And there is still a Medical Qigong Research Association in China. So there is an attempt to find scientific legitimacy for these therapies. I just want to very briefly point out that science itself might enhance the placebo effect. Because if people believe that scientific treatments are better, well, then maybe having magnetic stimulation at your acupoint with a machine is going to be better than having somebody put a needle in, because there's a machine and it's electricity, right? So things being perceived as scientific might actually make them more effective. In particular, one last kind of big cultural background here is the status of science in China. Since the founding of the PRC and even before, there's been a lot of discussion about what parts of Chinese tradition are superstitions that should be gotten rid of, and how the country can become more scientific. So this poster from the 80s is saying, worship science and destroy superstition. So there is a possibility that science itself is used as a kind of magical totem for what counts as legitimate and powerful. And I think that is the case. And when we turn to scientific research on these therapies, we can see that they often promise more than they can deliver. So there's a big push now for medicine to be based on evidence. That any treatment you give to somebody, you should have a good reason based in scientific evidence for giving that therapy. And this is, I think, a noble and great initiative. Chinese medicines have met that mark. Definitely, for example, Tu Youyou famously received a Nobel Prize for her work isolating a compound from a traditional Chinese medicine. That compound is now the world's first-line treatment for malaria. So these kind of biochemical approaches to studying Chinese medicine can be very important. I don't want to downplay that. There's a lot of research on, this is research on acupuncture for neurodevelopmental issues like autism, ADHD. There's a lot of attempt to build up that evidence base for these treatments. And this research has had great accomplishments, has gotten insurance in the US to cover, if you have insurance, to cover acupuncture for many conditions. People are running randomized controlled trials to try to prove that therapies have efficacy. That means this is kind of the gold standard of clinical evidence. You have two groups of people with a condition. You give half of them the real medicine, half of them get something else. Nobody knows who's getting what. And at the end, you see which group did better. But it's very hard if your intervention is, for example, acupuncture or massage. It's very hard to give somebody massage without them knowing it. It's very hard to control studies appropriately. It's hard to make sure that nobody knows who was in which study group. And it's very hard to standardize treatments that, as we saw for a Chinese medicine practitioner, ADHD might be a whole range of 30, 40 different conditions. Why are they all getting the same treatment? And therefore, if you look, if you're coming and asking how good is the evidence today, for example, for acupuncture, massage, for these conditions, most reviews end up saying the evidence looks good, but the studies are weak and potentially biased. But what I want to say, this on the left is an evaluation of the strength of evidence for Chinese medicine. On the right is a recently published evaluation of behavioral interventions and cognitive interventions for autism. Red is bad. And we see a lot of red and yellow on both sides. And in fact, a recent evaluation of mainstream therapies for autism concluded that if effect estimation is limited to randomized controlled trials where there's little risk of bias, no intervention of any type showed significant effects on any outcome. So there's something cultural going on here. Mainstream practices are seen as well-founded and evidence-based, but if they're held to the same standards that Chinese medicine is held to, they do not pass that bar. This is not to say that I don't think that these therapies help. I'm sure that cognitive and behavioral therapies help a lot of children. But it's very hard to prove that. And in general, medical research is very difficult. It's hard to isolate effects. There's a lot of concern about money funding studies, a lot of pressure to publish positive results, often a lack of long-term follow-ups. That's been a big issue in ADHD. Research lately, they found that long-term, the medications don't often have many effects. And then there's just straight up lying and fake papers and fake research, which has become a big issue. There is, after having said that, there is some very credible evidence for some TCM treatments for these conditions. For example, this looks like a well-designed study, randomized controlled study of a formula called Ningdong granule for ADHD, which found that it had as good effects as Ritalin, but with far fewer side effects. I don't know that I can discount that on the grounds if I take it at face value as a clinical study and don't try to suspect malpractice. But beyond that, there are many, many case studies. The clinicians I speak to are certain that their therapies often work. Maybe not in every case, but they say, we know this works. We see patients getting better, but we cannot produce the kind of evidence that will seem legitimate. Scalp acupuncture, for example. Well, a study found at Baptist University found an efficacy rate of over 97% for autism, for helping with speech and social deficits. But always, the conclusion is we need more high-quality, randomized, controlled trials. Another option is laboratory studies, which can produce evidence that is visual, right? Maybe we can put people getting acupuncture in a brain scanner and see what's happening to their brains. And people are trying to do that as well. And it is plausible and it is effective. There is evidence that acupuncture does affect blood perfusion in different regions of the brain and can be used in a targeted way to do so. The mechanism is there. It doesn't mean that that is actually treating the conditions. There's a lot of criticisms of these research approaches. Blood flow in an MRI doesn't necessarily mean that the problem is that autism is caused by poor blood flow or something like that. But nevertheless, these images that can be produced, images of the brain, are very convincing. Another thing that's done are laboratory studies with animals. For example, they take pregnant rats, give them a medication that causes the baby rats to behave in different ways, and then they're labeled as autistic rats. Now, people are doing things like taking these rats and giving them massages. I'd love to see these experiments. And then after the massage, no time to relax and enjoy your post-massage buzz. You are sacrificed and your brain is sliced and stained to try to find what the massage did to your brain structures. Now, I'm not opposed to this research on scientific grounds. Maybe this will yield some kind of insight into pathological mechanisms relevant to these conditions, but I think the chance is slim. Because in part, these conditions are very poorly understood in biochemical or genetic terms. So it seems to me a bit of worship of science and of the kind of evidence that can be made in a laboratory. And this is not just a problem with Chinese medicine studies. Good scientists, when I talk to the people who are doing the research, they acknowledge that their findings are always very limited, that their tools are not perfect. They admit this, they know this. The closer you get to science, the more humble you are. Also, you start to realize that what gets studied is a choice, and that is shaped by cultural factors, not only scientific ones. So now there's a lot of research on AI in Chinese medicine. AI palm reading also. There's a lot of research on probiotics and evidence that probiotics might prevent ADHD and autism. Research on green space, access to clean air, and how they affect child development. And I think it's not an accident that these kind of ecological perspectives are emerging at a time of ecological crisis. We think there's a problem with the ecology, so we look at our microbiome. This should be a reminder that mental health is not separate from ecological and social justice movements. It's hard to be healthy in a sick society, right? And you're not going to see that in a laboratory. This is a very different view of mental health from the common scientific impulse to seek truth at a molecular level. It's not always there. Sometimes you need a bigger picture. You don't always find discrete mechanisms for achieving specific outcomes. And especially in neuropsychiatric care, therapies are often non-specific. This has been, as I discussed, talked about it in the context of ADHD treatments. They might actually be working not because of their effect on neurochemicals, but because they help children to repair their bonds with their parents. These are complex, diverse syndromes. Many approaches may help. Why not try them all? TCM therapies definitely have demonstrated effects on sleep, digestion, sensory and motor skills. These are all emerging areas of scientific research on these conditions. Well, if acupuncture can improve your digestion or massage can help you to have better digestion, that plausibly could help with a lot of other symptoms as well. So I will wrap up. In practice, when I talk to clinicians, it doesn't matter what approach they are coming from, whether it's Western medicine, behavioral therapy, Chinese medicine, they all know in the end that you need clinical judgment. Good care is not only about having the correct treatment validated by science. This is a researcher in educational psychology who I interviewed here in Hong Kong saying, in the end, I tell my students, you have to collect data for that particular student in that context. Only then will you know which treatments will work for them. And in fact, you don't have to demonstrate whether it's your therapy that helped at all. You just have to make sure that things turn out as good as they can as a clinician. So here's a quote from Judith Farquhar, who's at University of Chicago. Every clinician knows that effective healing requires more than the mechanical application of scientific knowledge to never uniform human bodies. That is the fact of medical practice. You need to learn how to find the right spots, what works for whom. A massage that works for Stephen Chow might not work for you. So looking ahead, I think there are going to be a lot of developments in this field of treatments for autism and ADHD. I learned that Hong Kong is opening its first Chinese medicine hospital later this year. It's going to be run by Hong Kong Baptist University. And in their TCM, they have a special clinic for autism. And in fact, about a third of patients going to their TCM clinic are going for behavioral problems, pediatric behavioral problems. So I think there's going to be a lot of interest in this. The Chinese Medicine Development Fund has funded trials of acupuncture and massage for autism in the past few years. Still, there are a lot of misunderstandings about the nature of scientific evidence, whether or not it can really ground clinical practice. And I don't know which therapies work for whom, but I do think that people should be open-minded in trying and seeing what might work for their child. Especially because these conditions are poorly understood, they're diverse, and maybe in applying themselves to these conditions, TCM clinicians can assert the values of an individualized and holistic treatment that approaches the child looking at their sleep, their relationships, their digestion, and many other things. Another big concern is how TCM is changing. And in my research, I have seen a lot of concern about this, that TCM therapies are becoming more standardized, more based on treating symptoms, while clinical practice and TCM theory are devalued. So one big question is, if TCM will become just a set of therapeutics, the things that become validated just become a part of medicine in general, no longer Chinese medicine, or will TCM really contribute a different approach to thinking about health, healing, and knowledge? This is a quote from Volker Schied, an anthropologist and Chinese medicine practitioner. And he's asking, why not entertain the notion that the plurality of agents that impinge on human health may be best engaged by means of a similar plurality in the domain of medicine? Or maybe biomedicine can be a little humble. Maybe we don't know everything about the body. Maybe somebody who practices Qigong has learned something about the body that we don't know. I think we need to take this seriously. But this might sound metaphysical to you. This might sound like some new age stuff. But when you talk to clinicians, it's very down to earth. When I interviewed clinicians giving medical massage to children with autism, they speak in very down to earth terms. Without good circulation, of course, you won't be lively and social. If their meridians are blocked, of course, kids will be happier when you open them. It's not talked about as something abstract and metaphysical, but as something that people know and feel in the clinic, in their practice. But it's very hard to capture in an MRI. So there's so much uncertainty around the act of caring. And what I want to say is that we're really all in this space, and I'm not telling anybody what to do, because we all have to realize as clinicians, as researchers, as parents, as friends, we often have to live with that uncertainty around the way that we try to help people. And so I'd love to hear your thoughts about these issues. Thank you so much. Can you please,
Oh, yeah, sure.
yeah, if you ask questions, please tap the microphone so people on Zoom can hear you.
Test, 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 test.
Good.
Okay. I wonder if you could say a little bit more about TCM medical massage and the way that it's speaking to or is being integrated with sensory integration behavioral therapy. Because I remember a long time ago when I read Temple Grandin's memoir, she talked about how one of the most comforting things in her life was this like hug machine, and she would just go into it and it just made so many things better. So yeah, just if there's anything more that you can tell us about that, the relationship between those two things.
So when I read the literature about medical massage for autism, one of the things that is talked about as a potential mechanism by which it might work is by sensory stimulation. And like you say, sensory integration training is a very big approach now in mainland China, also not evidence-based. But the idea is that autism is a problem of sensory processing. There's a lot of reason to think that, and that somehow touch and massage can be a way to deal with that. However, a couple of people in the last days have told me, well, actually, many people with autism don't like to be touched. They find it very disturbing. And so it's not suitable for everybody. I also saw some other potential mechanisms by which massage might work for those for whom it is appropriate. For example, by promoting oxytocin is another focus of research. How does massage affect oxytocin production? And a lot of ideas about oxytocin as the love hormone. And so it gets labeled as something that maybe can overcome what are perceived as deficits in empathy and social connection. So yeah, thank you.
Hello, my name is Sophia. I'm an entrepreneur. One of my business is for acting as the education consultant for mainland China entrepreneur families. Actually, I invited my daughter, Christina, to come together because Christina was symptoms as the ASD medium level 2 years ago. But we didn't do any treatment or any consultation after the diagnosis. We just being fun and enjoy a more balanced life, just like a balance with qi, yin, yang, something. And we explore more interesting things she's interested in. She has a question. Actually, she's one of the toppest students in an international school. And she wants to ask you the question, whether one child diagnosis as the ASD medium level can be purely curified or purely perfectly fine as just like a normal child. That is the first one question. The second question is, one of my clients' families, maybe they have one or more children. One of them maybe diagnosis as ADHD or ASD. I'm thinking about, is it really over-diagnosis in nowadays? It's just weird, or more cases than comparing with 10 years ago. And yes, I need your professional idea for that. Thank you so much.
Well, thank you. And I would say I have read a study saying that there is some percentage of children diagnosed with autism who do seem to grow out of it. And it's not necessarily correlated with severity. Some people may be diagnosed with very mild symptoms, but they persist. And some people have very severe ones, and a minority of cases will resolve. And it's very poorly understood. So, of course, yes, this is possible. One question about these conditions also is, to what degree are they lifelong, and to what degree do symptoms come and go? Especially with ADHD, there are a lot of findings that symptoms come and go throughout people's lives. These aren't necessarily fixed. And I think this relates to the second question about diagnosis as well. Nobody really can tell if there are more cases or if it's just more awareness. I think a lot of people who are doing clinical work are convinced that there are more of these cases. Nobody knows why. There's a lot of talk about, is it environmental toxins? Is it what's going on here? Is it technology? Nobody really knows. It would be very difficult to figure that out through study. So the question of overdiagnosis, though, I think the question has to be very individual. If you think that the benefits of having that label and that diagnosis outweigh the harms for a particular child and for a particular family. If that diagnostic label gets somebody access to treatments that they find useful, then it's probably good. But for some children, it may lead to dependence or reliance. There are side effects. There can be issues of stigma that are involved. For example, needing to hide your diagnosis from colleagues, from people at school. So I really think in the end, this is not a medical decision, but one that parents and, if possible, children, if they can be involved, need to make together. Yeah.
Okay. I have lots of questions. It's really interesting, but I think it's all interrelated. So my first question is about the Chinese medicine. I mean, as you mentioned, it's a broad categories, and in the practice, I can see like they have products, they have herbals, like they have Chinese patent medicine, acupuncture, etc., etc. But can you explain more about to what extent they use this practice? For example, they use it as a supplement, or they use it like a mental, as a major way to treat ASD or ADHD. And that's related to another question is, how do we understand different types of Chinese medicine? Are they products? As you mentioned, lots of advertisements published by companies as well as hospitals, or it's actually a medicine, for example, promoted by scientists, by TCM doctors in the colleges. And as you also share lots of Xiaohongshu's posts, so lots of people, they can talk it freely. So how can we understand it's like more like a professional opinion, or it's much more like lay expert opinion, or they actually involved in this business, they promote something.
Yeah.
So yeah, I'm.
So your intuition is very much on the spot. Most of the people who are medical experts on this media platform end up trying to sell something, whether it's a training program or a supplement. There are also concerns that this drives prescribing in hospitals. And now that in China, there are strict controls on the prices of pharmaceuticals, there's a sense that people might be prescribing Chinese medicines to make money because they're harder to standardize. So you can say, of course, this medicine is very rare and high quality because it's an herb. You can say that it's worth a lot of money. And some people will be willing to pay that. So the financial aspect is very important. But a lot more content on Red is produced by parents. And is more in a spirit of kind of mutual help of, for example, I learned how to do stomach massage for my autistic child who had digestive problems, and it's night and day. They're so much better now. People should know about this. In terms of what medications are being used, in the mainland, psychiatrists people with biomedical degrees, they can be fairly comfortable prescribing what are called 中成药, patent medicine. So these are standardized formulas, usually available as pills or capsules, sometimes as things, powders, granules, right here in Hong Kong. And they are very widely used in ADHD, mostly to deal with the side effects of the pharmaceuticals. Appetite, sleep, and mood issues, things like that. There's also a perception that they make the therapies more effective. For autism, it has been more difficult to see how that works in official institutions because many people are directed to community health clinics and from there to training centers to do behavioral therapy. So they might not end up in a very official, they might not be face-to-face with a psychiatrist. But I have been told by parents of children with autism, diagnosed with autism, that if you go to a hospital, you get like a treatment package that might include training sessions, consultations with psychotherapists, and you will be seeing a Chinese medical doctor as well. So yeah, there's a big difference between the herbs that would then be boiled by yourself or by the hospital versus the standardized formulas. And most people think that the standardized formulas are less effective, or they can be effective, but you need to know if they will work for you. Because one of them might be, say, bolstering your yang, but if you already have a surplus, you're going to be harming yourself. People can buy them on their own, most of them in any pharmacy. So a lot of it is self-diagnosis, self-use.
Hi, thank you for the lecture. I read a book a few years ago about Chinese medicine. It's about the vibe that has no flavor. I think it's one of the famous book in the Western hemisphere. Basically, it also pointed out the issues you mentioned because for the same sort of a diagnosis from a Western point of view, the Chinese medicine practitioners may identify multiple patterns as you just illustrated, right? So my question to you is specifically with regards to the diagnosis of these two illnesses or symptoms. We all know that in Chinese medicine practices, right? So the doctor, the practitioner needs to observe, right? They have to smell of, right? This is the way to establish the connections. And also they have to inquire. So that's and then the palpation, of course, that's it's more physical. So my question to you is, in terms of the inquiry, right? Because the inquiry is, also mentioned in this book that one of the most difficult things is the inquiry because the patients normally don't know how to, they don't understand their symptoms. They don't know how to describe them. So they basically give them a lot of things. Sometimes they even lie, right? So when they are trying to diagnose or trying to establish this kind of understanding with those people who are either have ADHD or autism, especially when they're children, how they can inquire. If they cannot establish through the line of inquiries, how would it even be possible for them to diagnose this in the first place? So again, going back, I think that's my question.
So I haven't been able to observe clinical sessions with children they'd be difficult to do for ethical reasons and approvals. I've seen some in passing, but I don't have a great sense of that. My sense is usually questions are directed to the parents or the caregivers.
Right, but as you mentioned, right, because we don't even understand what these symptoms are, right? So I do have known people whose children have this kind of being diagnosed as ADHD or autism, right? I have very close friends. Actually, I'm from Chicago booth. So one of the child of classmate has autism, right? So we had a very in-depth conversation. So basically, they spend a lot of time. It's more like caring, cultivating, the openness of the. There's no methods. It's really just act out of their heart, right? So it's a very prolonged process, and it's but they also have strengths. A lot of people who are diagnosed as, put a label as such, they have a lot of strengths. They have a lot of, that's what the biodiversity is a thing everywhere. So again, it's very difficult for me to understand. I mean, even the parents, they were told their children having this, without knowing what it is, right? This is very dangerous, especially from a Chinese medicine point of view, because we never specify the phenomena without knowing the substance, the essence, right? This again, you talk about standardization, because Chinese medicine is not, it shouldn't be standardized, right? It's very customized based on that connection from a physical and metaphysical point of view. So when it's become standardized, I think you have a lot of arguments as well. It become quite dangerous, as to how it's applied, right? So again, I don't know the specific area of research, but I think that's a main concern that I have when I'm hearing this.
So clinicians who I've been talking to, they tend to feel a bit conflicted. They'll say things like, well, why not be able to share what the best practices are? There's a sense that Western medicine science is about sharing. Everybody publishes their approach to treatment, whereas in Chinese medicine, a lot of transmission has been dependent on building the right relationship with an individual treatment, an individual teacher, a lao zhongyi, and that there should be more of a spirit of sharing, which could lead to standardization, but also could be seen as a sharing of clinical experience. Some people go for something in the middle, like, and in fact, there is some standardization in Chinese medicine as well, right? There are standard prescriptions, standard formulas for certain conditions, and then people adjust from those. So there's some element of individualization and some element of commonly used approaches. It's not like each patient is approached entirely anew, right? Yeah, but it is a big issue if you are trying to ground Chinese medicine practice on the basis of research, because it's hard to say, well, each of these people got a different therapy, but it's all Chinese medicine, and therefore it works. Some people actually have told me that's not the case. You can keep the therapy as a black box and just say, these people got herbal Chinese medicine, did it work or not? And after that, maybe you can do further studies to figure out which ones are most effective. Some people are trying to take that approach as well, to just study the system as a whole. But yeah, there's a lot of debate in the community about these issues.
Thank you.
Thank you, Professor, and for your very comprehensive presentation. And there's a question I want to ask you, is the title of your presentation. The title is The Rising of Chinese Medicine Therapies for ASD and ADHD, right? What you are talking about is just about the Chinese medicine therapies just carried out in China, Actually, in China, it has been used a long time ago, and in your presentation, there is no comparison that be how many years ago and the rate of the people use Chinese medicine to treat such kind of disease, and to compare with now, there is no such evidence to show it's rising, If the title is The Rising of Chinese Medicine Therapies for ASD and ADHD in USA or in Hong Kong or in any European countries, that might be more interesting, Yeah, because Chinese medicine as a very major medicine, treatment system in China, actually, I think more than 15% of the people, they use Chinese medicine, or they use the Chinese medicine and combine with the Western medicine as well. And even in the Chinese medicine hospital, the doctors always just prescribe the Western medicine and combine with the Chinese medicine, It's very common. It's very common. So I couldn't see the rising, the words you use, the rising. From your just presentation, I couldn't see that because it's happened long time ago, and up till now, it doesn't change, Yeah.
Absolutely. I think especially there are a lot of historical precedents for what we're seeing now. A lot of the therapies are not new. At least the application of Chinese medicine in general to child development is not new at all. ADHD, maybe it should have been titled The Rise of ADHD and ASD, and the application of Chinese medicine to these conditions. But that would have been a more rigorous phrasing for sure. So ADHD has been widely diagnosed since around the 70s, is my understanding. But autism awareness and even the availability of treatments is much more recent, really from the 90s. So historically, these diagnoses are fairly new, and the diagnoses themselves are spreading a lot. The idea of a rise also would be more properly applied to the rise of, I think, people using home remedies from Chinese medicine for these conditions because of social media, for example, these kind of issues. But definitely, my daughter is very active, and the doctor said she should take what's it called? 六味皇帝丸. All right, like, okay, this is a Song Dynasty prescription, and it has been applied for pediatric cases for a very, very long time. It's not new. I think what's new is the consciousness of ADHD and autism. And my suspicion that I can't fully prove is that this is and will lead to a much broader application of therapies for these conditions. It's likely, but I don't really have the historical evidence to show that. Yeah.
And may I just continue my question? Yes, thank you. And as you mentioned, the difference between the ASD and the ADHD, of course, the two different types of the disease, right? They have the different symptoms as well. And the thing is not just about the diagnosis. And the Chinese medicine in China seems all of the disease that can be used to treat just by Chinese medicine, even cancer, something like that. The thing is just once there is the disease, stay there, and there is a method to treat it in Chinese medicine. That means no disease Chinese medicine cannot treat, but the result, the outcomes, good or not, they cannot just make sure. Yeah.
So
because it's, in Chinese medicine, especially just in the Chinese medicine, medical herbs, and the herbs, they have thousands different herbs, and the herbs is so complicated, and it's not just the single, chemical, just components inside it. It contains even hundreds of the components, chemical components. And how to use the Chinese medicine properly is a very critical question. And if you can use it properly, really, the effect is really good. And in Chinese medicine practitioner, there is a 神医, that means, but in Western medicine, there's no 神医, because the herbs is so, is so amazing. Sometimes you can say, oh, it's really amazing. It's amazing. Just like acupuncture, the same. If you use it properly, it can cure a lot of diseases, not just about the ASD, ADHD, and all of the mental illness, function disorders. It can be used. Yeah. Okay, thank you.
So yeah, definitely the areas where Chinese medicine is applied today don't necessarily represent everything it can do. And I've heard people talking about, well, we're not good at treating certain diseases today because we don't have the chance to do it, because we're not approached to treat those kind of acute conditions, or only if people are also getting Western treatments. Historically, before antibiotics, Chinese medicine was seen often as more effective than Western medicine, broadly, including in Hong Kong and Macau. If you read histories, in the colonial period in the 19th century, Westerners were more likely to go to a Chinese medicine doctor. It was perceived as being more effective than anything they had. I think antibiotics were really one big change, especially regarding infectious disease. There are attempts in China to expand back into areas where Chinese medicine used to operate, like emergency medicine. There are textbooks of emergency medicine. Some Chinese medicine doctors are trained as well in biomedicine. Some do surgeries. It's really very blended. I think the ultimate issue then becomes accountability. And if it's something like cancer, things like that, still the legitimacy of Western medicine is seen as higher. And I think some practitioners themselves also would worry about malpractice, or somebody yesterday mentioned to me, if something goes wrong with Western medical treatments, they blame the treatment. If something goes wrong with Chinese medicine, they often think the doctor isn't good enough. Because as you say, the doctor themselves is such an important part of administering the therapy. So yeah, there are a lot of complicated issues here around accountability, liability, and what is perceived as the safest choice. And I think in the end, these are not necessarily scientific questions. They're about culturally how people are viewing these systems.
Hi, Professor. Thank you so much for your very interesting talk. And I have two questions. So first one is, I'm quite curious about you talk about when parents are finding or trying to find help or to seek doctors, what are actually the factors that influence their behaviors? Like what makes them to see a Chinese doctor or not to see a Chinese doctor, traditional Chinese doctor? And my another question is about, since I'm also a researcher doing RCTs, also doing TCM studies, like from your observations, what's your conclusion or your suggestions for after you reviewing all this meta-analysis or those reviews and also those RCT studies? What do you think, what kind of suggestions you have to this future studies about the study designs and also about how to improve all this RCT studies? Because for Chinese medicine, the patterns is so complicated and there are so many patterns about the syndrome. Then how could we improve our RCT studies to better suit the situation? So that's my question. Thank you.
So I'm not a person doing research myself, but I've been reading these reviews and talking to researchers, and it does seem there are a few systematic issues. One is a lot of the researchers are clinicians and they're not trained in research methodologies. So sometimes they partner with people from medical schools to do the research, but it's not always done by a team of people who are fully invested and want to try to produce evidence in the same way. One big issue is outcome measures are often seen as subjective and therefore subject to bias. A lot of people for these conditions, the studies are using parent reports of whether or not their kid got better. And that's seen as low-grade evidence because the parent knows that their child had this intervention and might be predisposed to see changes. So there are things that could be done, like promoting methodological training, ideas about what best practices are, like have independent assessors for the children and have different ones do the before and after assessments. But these are also issues of cost and time. Another thing that came up, not from myself, but from an interview I did, is the idea that some of the outcome measures might be made more objective or might come from Chinese medicine. For example, changes to the pulse or the tongue, and to try to produce those data mechanically in a way that would seem more objective. So for example, people have tried to map different pulses into waveforms. There are machines that can produce something. It might not be the same thing that a clinician would, but it could be perceived as a more legitimate outcome. And then a final one is this issue of individualized treatments and trying to really design studies where maybe different clusters of patients are getting different treatments based on Chinese syndrome differentiation. However, there are a lot of problems because there are other relevant ways you could group the patients as well. Like you could use psychological theories to group them differently. You could group them differently based on subtypes of ADHD or autism. You could do all of it, but the more ways you're subgrouping patients, the more people you're going to need in your study. And so one frustration researchers have had when I talk to, they say, yeah, we know that there's all this heterogeneity in the sample, but if we really wanted to pick that apart statistically, we would need to recruit 10 times as many people. And we already don't have the ability to recruit these 20 or 30 who signed up. It was already a stretch. So I think what I hope to do, I'm new to this field. I'm not an expert in clinical research, but I am trained in thinking about science from a critical perspective. And I really want to learn from researchers and hopefully start dialogues among people, people who are probably very busy doing the clinical work and the research and might not have time or some of the theories for thinking about what might be done. And I know that there's interest also in Hong Kong, at least, in trying to promote methodological training for clinical researchers. I don't know, some people I talk to are very hopeful that better research designs will produce evidence of higher quality, but almost everyone is convinced that there's going to be some remainder that just can't be captured using these methods. So, I don't know.
So there are some questions from Zoom audiences. So one of the question is, it looks like your research mainly focus on children. So how is the use of TCM on adults with ASD and ADHD? And another question is, she would like to know the gender ratio in your case studies, since the ASD in females is relatively poorly understood compared to ASD in males. So how does that affect your research?
So I don't think I have, this is the problem of a sample size, right? I don't think I have enough that I can generalize about differences in gender and how that might affect use of Chinese medicine. I really don't know. Of course, ASD is diagnosed much more in males, and I see around me a lot more concern around parents with boys. Maybe, sometimes for reasons that seem very well founded, and sometimes maybe not. These are big areas. Boys are more likely to be diagnosed with ASD for sure. ADHD in girls is also less understood. It often manifests differently with more inattention, less overt behaviors. And there's a lot of concern about cases that might be missed among girls. And yeah, my research is focusing on children. I would guess, and anecdotally, adults are also using Chinese medicine to manage symptoms, but I haven't really focused on that, so I can't say.
I actually have a question. Yeah, thanks really much for your presentation. Like I noticed how Chinese medicine a lot of times its value is manifests in how the patient feels, and a lot of times it's not like something that can be based on scientific evidence. So would you be able to share some insight in like what are some causes of like how Chinese medicine is not perhaps not gaining as much acceptance? Yeah.
So yeah, definitely. I talked a bit about what outcomes get measured for treatments, and one big one that researchers talk about is quality of life. And there is a scale that has been often used, validated, called the QOL scale. It's used often, for example, with cancer patients, people who might be getting treatments to try to alleviate suffering more than necessarily treat a condition. Definitely improving feelings of either comfort or well-being. These are common uses for Chinese medicine today. And people are trying to bring that into a scientific basis. There was even a quality of life scale developed specifically for use on Chinese medicine research, but I was told nobody used it after it was developed. So the question is, what would really be accepted as solid evidence that these treatments are doing what they are supposed to? Evidence that would get beyond allegations that this is placebo, and if you did anything else, it would also work. And these kind of questionnaires, rating scales, they are accepted in many fields today, like palliative care, because there's no other measure that can be done. But then why is that more valid than ratings by a Chinese medicine clinician or using other kind of instruments that end up just being checklists of questions or 1 to 5? A lot of what counts as evidence, I think what I want to say is a lot of what counts as valid evidence depends on consensus within the profession and among researchers, and isn't necessarily meaning that what's being measured is the best thing to be measured. Quality of life is very hard to capture, but so are, for example, conditions like depression and anxiety. They're done with checklists. If you are, now there's a lot of attention to postpartum depression in China, for example. After my wife gave birth, within 30 minutes, somebody came with a checklist of 3 questions. How are you feeling now? Like, done. Like, is that scientific, you know? Because this questionnaire was approved by some committee in America, probably. You know, there are real questions about how to measure things that are often non-specific. And I think that's one of the themes I tried to bring out, that a lot of health and healing, it's not this picture of here's the problem and let's find the magic bullet that will hit that point. These are much broader issues. Even happiness, like, are we supposed to be happy? You know, there are a lot of philosophical issues around this that are fascinating. And that's why I'm trying from a kind of perspective of looking at that cultural factors, how they affect people's perceptions, I think are really important. Thank you.
One more question for you, Professor. Also, you go first. Okay, one more question for you, Professor. As like cancer in the United States or in Hong Kong, actually it is integrated treatment, I should say. For example, for the ASD or ADHD, is it more like using integrated methods in your topic, applying Chinese medicine to this treatment based on your studies in the past few years? So who is the main doctor? For example, my daddy had 3 times cancer in the past 10 years, and actually 3 different cancers, but he had main doctor at Hong Kong's private hospital. But for the ASD or ADHD children, through the whole process of the treatment, is there a main doctor? I want to learn more about this aspect. Thank you.
So most people seem to be using both or multiple kinds of treatment together, unless people are unhappy with especially pharmaceuticals. Some people don't want to use, in which case they will go more for Chinese medicine. For most people, it is integrated. What was the other question?
Right. Key doctor. And the second question is, if it is integrated treatment, what kinds of people or what kind of doctors should combine together to work closely together for one child?
Right. So in outpatient care, most of these cases are outpatient. They're not going to stay in the hospital. There is no close integration among treatment teams. So you're going to a psychiatric ward and you're going to see a psychiatrist. Now, most psychiatrists will be prescribing Chinese patent formulas. But if the parents also want to see a Chinese medicine practitioner, then they have to go again and make a separate appointment. So it's integrated in some ways, but still very separate in others. Inpatient care is different. For example, for cancer, which is one area where the evidence base for acupuncture and Chinese herbal medicine is considered very strong. If you're an inpatient, your care will be much more integrated, where acupuncturists will be called in to help, for example, with side effects from chemotherapy and so on. But because these are acute conditions that would have you staying in the hospital, it's often viewed that biomedicine's approach of let's really destroy this problem is more appropriate and safer. I think that approach of let's find one mechanism and really maximize our targeting of this mechanism, it has its advantages, especially in something like cancer, where you really want to make sure you destroy some kind of lesion in the body. But of course, that way of thinking is also much more likely to produce side effects, in my view, because you're really trying to destroy or to really work on one kind of biological pathway, as opposed to the idea of in Chinese medicine that you're adjusting an overall state, which seems much less likely to end up in kind of producing problems. All right. Thank you, everybody, for coming.